On a recent evening in Rome, a couple of dozen people get their jabs at a pop-up COVID-19 center. Some are homeless, others are immigrants. Clinics like this are the only chance they have to get vaccinated.
You can't get a vaccine appointment, a health card or visit a doctor if you're like me and your residency isn't sorted out.
Across Italy, there are more than 600,000 people who live and work without documents, many of them migrant farm workers from Asia and Africa. And for months, Italy has struggled to find a way to reach these communities. It was made more difficult because the delivery of care is handled by Italy's 20 regions, so each region has had to come up with its own plan.
È una sfida sanitaria ed è una sfida anche politica.
It's a public health and political challenge. The goal is to provide a service to the last ones in line, migrants who have been totally exploited. And at the same time, we help ourselves by vaccinating them.
Now, regional health officials are partnering with agencies and charities and going directly to these communities, making appointments for people whether they have national health insurance or not. They're also setting up mobile vaccine centers, like this one on the edge of a large immigrant community.
In 3 days, officials have vaccinated more than 1,100 people here, all of them migrant farm workers, and 20% of them have no legal work papers.
We asked some here if those without documents were afraid of being caught out and sent home just by taking the shot. Through a Punjabi translator, one undocumented worker told us he wasn't scared. He just wanted to be safe from COVID-19. Many migrants are given a single Johnson & Johnson dose, an acknowledgement that they are hard to track down for follow-up appointments. Some officials, though, are hoping this is a turning point for Italy. At the pop-up clinic in Rome, temporary national health cards are issued.
So the vaccination become an entry point to give some form of health assistance to people that do not have the opportunity.
Italy relies heavily on foreign workers to pick its fruit and vegetables. Although regions are trying to vaccinate as many people as they can, there's no national database of how many undocumented migrants have received the shot. That poses a risk both to the migrants themselves and Italians. Raney, Al Jazeera, Rome.